So, how does autoimmune disease affect the eyes? Or if you have an eye condition or you're having blurred vision, something going on with the eyes, could it be possibly related to an autoimmune condition going on throughout your body? Today, we are going to be breaking down how autoimmune diseases affect our eyes, as well as kind of highlighting the symptoms, things that you should be aware of, and the questions, the type of questions you should be asking your doctor and bringing up during an exam so that it makes it easier for your doctor to kind of connect that perhaps there could be an autoimmune condition going on. Now, if this is your first time here, checking out the Dr. Eye Health channel. My name is Dr. Joseph Allen. I started the Dr. Eye Health channel about 5 years ago to really help bring education to the world about eye diseases, different eye conditions, help people learn about treatments, as well as vision products. So if this is something that really interests you and you think is fascinating, please consider subscribing to our YouTube channel so you don't miss any of our future videos. Also, consider becoming a channel member to the Dr. Eye Health channel because that helps support all of the work that we're doing. You also get some great perks as being helped choose the topics of our live lectures that we do every month, as well as get priority in our live Q&A that we do at the end of the lecture. So thank you guys all for being here. For the people who are catching us live, as well, if you're catching on the replay, let us know in the comments first where you're watching from, as well as if an autoimmune condition either is something that affects you or maybe somebody in your family, because these are something that are actually quite prevalent and unfortunately is becoming more frequent in the literature. That yes, perhaps our tools and knowledge of how to diagnose autoimmune disease is rising, and perhaps that's a reason we're catching more of it, but also it's believed that a lot of environmental changes and lifestyle factors are contributing to the increase in rise of autoimmune disease diagnosis. So, with kind of that topic tonight, we're going to be focusing on how things affect the eyes. Now, there's a lot of autoimmune diseases out there, and we're not going to have enough time to cover all of it and go super in depth onto all of these conditions. But we really want to highlight the ones that are most frequent and the ones that you might be experiencing, feeling on your own eyes, things that you can bring awareness of, especially to your doctor and other medical professionals that you work with. So some of the big ones that we're going to be touching on include things like multiple sclerosis, things like diabetes, Graves' disease or thyroid conditions, psoriasis and other skin conditions, as well as GI, gastrointestinal autoimmune diseases, and even ones that affect our bones, and even more around the lacrimal gland itself. So the first one I want to break down is that of rheumatoid arthritis. And I want to break this down because it is quite frequent. And I remember even my grandparents starting to have problems with rheumatoid arthritis. This is where your autoimmune system, your own immune system starts to attack itself, kind of like your immune system is really designed to attack foreign invaders and pathogens that are coming into your body. This is the general idea of an autoimmune condition is your body starts getting confused and attacking your own organ and body like it's a foreign invader. And with rheumatoid arthritis, this attack happens in the synovial tissue in your joints, and this causes really extreme levels of inflammation. But it doesn't just happen in the joints, it somehow communicates to the eye. And about 20 to 30% of people who have rheumatoid arthritis end up having some involvement of the eye. At least that's what's reported in more recent studies. And I personally believe a lot more patients with, or people with our rheumatoid arthritis end up probably have more issues with the eye. It just goes either unreported or people aren't connecting the two. Some of the big ones that are listed here, we're going to run through these and explain a little bit more in depth, because a lot of the other autoimmune conditions that we talk about in today's presentation also present with a lot of these similar other issues with the eye. The first big one, and we talk a lot about dry eyes on this channel because I myself have suffered with dry eyes since about my late teens. And it's something that I've spent a lot of time kind of working on, being interested, reading a lot of research in. And it's something at our clinic, I do a lot of dry eye treatments. If you have rheumatoid arthritis, you're having increased inflammation, and there's a strong connection between arthritis and having dry eyes, mainly because of inflammation. If you've never seen what dry eye looks like on the surface of the eye, this is a picture of a patient that I saw just a few weeks ago who was not even really aware of how dry their eyes were. But on the front surface, we put a yellow dye that we call fluorescein sodium. And this yellow dye kind of soaks in and fills in any damaged cells on the surface of the eye. And then we shine kind of a blue cobalt light on it, and it glows kind of the way like a glow stick or black light kind of paint would glow under a black light. And we can see on the zoomed in photo over on the side how much damage there is on the surface. So when a patient or somebody has dry eye symptoms, that's because the surface is irritated and getting damaged from the excessive dryness. And every time somebody blinks, that eyelid comes down and rubs that damaged tissue. And it's kind of like taking your fingernails and scratching an open wound. And it stinks because every time you blink, you're going to feel that. And your body's in a constant state of, I'm trying to repair myself. I'm getting damaged. Repair myself. I'm damaged. And then the inflammation just kind of kicks in and becomes a cyclical process. Another condition, and this is another one that I just had a pretty severe case of that I'm managing right now. Sometimes patients come in because they have a red eye, right? You think you maybe have an infection like a pink eye, which is termed conjunctivitis, which could be a bacterial infection or a viral infection, maybe allergies. But it could be because it's not an infection. It's not any of those. It's because a deeper level of inflammation going on the eye. One of these possible diagnoses is called an episcleritis, and another one is called a scleritis. Episcleritis, it could be caused by just an irritation to the eye. It's usually not painful, but the eye kind of looks red, feels irritated, and may tear quite a bit. The thing is that when we diagnose an episcleritis, we'll put a medication in and it'll blanch. It'll turn white, like you see in that photo at the top. And if somebody has a deeper level of inflammation that's affecting the sclera, the deeper vessels of the sclera, then you see when we put that same medication in, it does not blanch completely white. It stays a thick, heavy red. Unfortunately, both episcleritis and scleritis can be associated with rheumatoid arthritis and many other autoimmune conditions, but scleritis is probably the worst one. Thankfully, we don't see scleritis too often, but whenever we do detect a scleritis in the clinic, we do have to order a lot of blood work to determine if there is some other form of autoimmune condition going on. The list on the side, we're not going to go too in depth on that, but I expect if anybody's watching this, if you're going to medical school or you're going to optometry school, or if you're just interested, you can always refer back to this page of possible connections to an episcleritis or a scleritis. And some of these we will be touching on later on in our presentation. This next one is called peripheral ulcerative keratitis. Again, rheumatoid arthritis is connected to this. And this is where the cornea on the surface of the eye, the window to the eye, becomes thinner. And it's always kind of in the peripheral cornea. It's not dead center, but it can be progressive. And it's can be kind of concerning. And as an eye care professional, we have to detect this and consider different treatments. The other one that's I see a lot more frequent is something I manage quite a bit in our clinic is that of anterior uveitis. And a uveitis is a pretty severe form of inflammation inside the eye. If somebody has a uveitis, and maybe you've had one, this is where your eye becomes red, becomes very light sensitive, your vision can become blurry, and it's like having a headache in the eye. That's kind of an easy way to think about it. But when we when we are examining the eye, one thing that you can see that you see in this photo is you can see white blood cells inside of the eye. We can see these white blood cells spinning and floating in the fluid inside the eye called the aqueous humor. And this is basically telling us that there's a breakdown of what's called the blood aqueous barrier, and the white blood cells are leaking into the eye. But again, arthritis is a big one. So if you ever have an anterior uveitis, your doctor will likely order blood work to make sure you don't have arthritis. This next one, retinal vasculitis, thankfully quite rare, but I've had a few patients of that have had retinal vasculitis myself. Not myself. I've had patients who have retinal vasculitis, just to make that clear. But this is something that basically is inflammation of the blood vessels within the retina in the back of the eye. And this is a big one because asymptomatic people, like people that don't have symptoms, they feel like, hey, my vision's fine. I just want to update my glasses. They'll come in and see us. And unfortunately, during the examination, I'm looking in the back and I'll see retinal vasculitis. And it's scary because they may not have a vision problem because it's out in the periphery of the back of the eye. But the problem with vision loss is it's kind of like a cliff that you can't see. You feel like you're doing fine, you're doing fine, you're doing fine, and all of a sudden you jump off a cliff and your vision deteriorates rather quickly. So this is just, I want to kind of use this as a reminder that if you haven't had a comprehensive eye exam this last year, within the last 12 months, I do highly recommend it just to make sure, even if your vision's fine, just to make sure things, that you don't have something sleeping going on, right? Because I don't want you to lose your vision in the next year or anything like that because of an undiagnosed disease that we could have caught and treated. Outside of rheumatoid arthritis, another big one is we're going to move from arthritis, the joints, we're going to move into the skin. Psoriasis. This is one that also is quite common. When I say quite common, it's like 2 to 3% of the population, but I do see it frequently. And I think it maybe does go underdiagnosed. Psoriasis is where you have autoimmune attacking basically your skin, and your skin starts producing, it goes through a faster life cycle. And it ends up being really itchy, irritated. It comes in these patchy kind of scaly spots. And it's oftentimes I see it right on the hairline for a lot of patients. And you can imagine if you're getting this dry, scaly kind of patches around the hairline, it can also affect your eyelids and kind of the eyebrow here. And so some of the different conditions it's connected with is blepharitis, which is, again, you'll see scaly, oily buildup along the eyelashes and the eyebrow here. You can have conjunctivitis, which is, again, inflammation of the conjunctiva, the clear membrane on the surface of the eye, which could be also signs of bacterial conjunctivitis, like a pink eye, or a viral conjunctivitis, which is a pink eye. And then there's dry eye. It's all connected to those three, as well as uveitis again. Multiple sclerosis. This one surprises a lot of people. So multiple sclerosis is an autoimmune attack of the myelin sheath around your nerves. This is kind of the fatty sheath that insulates your nerves to allow signals to propagate and communicate to other nerves throughout your body quickly. And so, unfortunately, these myelin sheaths start to get degraded, and people start to have a lot of neuromuscular communication and just nerve-to-nerve communication issues throughout their body, and it can significantly change your life. So the way it affects the eyes is because the optic nerve connects to the eye. And if you have what's called an optic neuritis, an inflammation of the optic nerve, and usually this is behind the eye. So you may have a vision issue, such as not only your vision going blurry, but your color vision may change in one eye. So if you kind of compare left and right, you may be like, why is everything really dull or dim in one eye compared to the other? I've had one patient who was quite the opposite. She felt like everything was brighter in the other eye. The other big ones is double vision, as well as pain with eye movement. And the reason you have pain with your eye movement with optic neuritis is that you shift your eyes side to side, your optic nerve kind of gets pulled back and forth by your eye muscles a little bit, and you can feel that. Statistically, about 50% of everybody who gets diagnosed with multiple sclerosis will eventually have some form of eye issue. And about 25-30% of people who get diagnosed with multiple sclerosis will be initially seen or diagnosed by an eye care provider because they first start having problems with their eyes. Another issue is internal ophthalmoplegia, internuclear ophthalmoplegia. This is where your eye muscles start to get affected, so people have double vision, and then nystagmus, where your eyes will shift back and forth very rapidly. So unfortunately, if somebody does have really severe bouts of optic neuritis from multiple sclerosis, you can have vision loss, not just blurred vision, but patches of your vision start to get lost due to some optic atrophy related to that. The big thing I just want to point out is if you've ever had pain with your eye movements, if you've ever had vision loss or color vision or something changing in one eye versus the other, this is something to definitely mention to your doctors And if you're starting to experience it, make sure you see a doctor sooner rather than later. Myasthenia gravis. This is another one that I bet a lot of people have not heard of, but let me know in the comment section if you have ever heard of myasthenia gravis, or maybe it's something that a family member has had. So this is where your autoimmune system starts attacking the receptors in the neuromuscular junction between your nerves and your muscles. And this ends up resulting in extreme fatigue. So bad that for someone who has myasthenia gravis, a classic example that we kind of learn in our education is if somebody's going up the stairs. So they may get halfway up the stairs and then you'd have to stop because you just don't even have like the energy to make the next few steps to keep going, because all of the signals in the synaptic cleft they're not signaling to your muscles to move. And so you feel really drained and fatigued. This affects the eyes mainly through double vision, as well as an eyelid droop. A lot of patients will have their eyelids getting very droopy and heavy later in the day. And this can not only be a big signal to us that, oh no, we have to check for myasthenia gravis, but this can even have complications like with dry eyes, because patients can't maybe close their eyes all the way. They can't control their eye muscle movements. And then they end up with exposure keratitis. And that's what that picture is in the bottom corner with the kind of the green looking eye there, is the very bottom 1/3 of the cornea is highlighted. That's because that person's eyes are always open just a little bit. Thyroid, that kind of connects to thyroid eye disease, because in myasthenia gravis, something that we have to always check for is what's called a thymoma. And it's connected or believed that your thymus here in the front part of your neck has some dysregulation and may have kind of an attack on itself, and that leads to myasthenia gravis as well as other autoimmune conditions. But there's this relationship between myasthenia gravis and thyroid conditions, because a lot of treatments for thyroid problems end up kind of on a teeter-totter, where if you treat thyroid conditions, then myasthenia gravis gets worse. Or if you treat myasthenia gravis, then thyroid conditions get worse. And so it's something that your doctors should all be aware of and monitoring for thyroid conditions as well as possibly myasthenia gravis. Now, thyroid, typically the two biggest ones that we are always aware of are Graves' disease. This is where you have too much thyroid or overproduction of thyroid hormones. Or there's Hashimoto's, which is hypothyroid. You don't produce enough thyroid hormones. Typically, the symptoms that people will have are like, if you have Graves' disease, you have too much thyroid, you have a lot of energy, your metabolism is really fast, and you typically lose weight pretty quickly because you have a faster metabolism. Hashimoto's is just the opposite. You feel really fatigued and sluggish. You tend to gain weight more. Your metabolism isn't as fast. And you feel temperature-wise. Graves' disease, people feel really warm. Hashimoto's, people feel really cold. So with how thyroid affects the eye, and I've done a video on this, but thyroid, the same autoimmune signals end up attacking your, they have very similar attacking not only your thyroid, but it ends up attacking the muscles around the eyes. And that causes swelling of your eye muscles. With the swelling of the eye muscles, it starts to even become a little bit fibrous, but it pushes the eyeballs outward. We call this exophthalmos or proptosis. And so there's a few pictures here where what we look for in the clinic is something called scleral show, where if just you're resting and looking at somebody, the top of your eyes, like the white on the top of your eyes, you can see that. So if somebody has this, we initially start to do some tests to kind of measure, hey, are their eyes bulging forward? Is this potentially a thyroid condition? And then we always refer and do laboratory workup for possible thyroid condition. But because the eye muscles become swollen and fibrous, it can lead to double vision because you can't control your eye muscles very well. And in extreme conditions, it can even compress and push on the optic nerve behind the eye, and that can lead to permanent vision loss. A lot of, again, we did do a video on thyroid eye disease. If this is something that maybe runs in your family, I definitely encourage you to check out that video because it goes more in depth on the possible signs of thyroid and possible treatments and what your doctor is going to be looking for. Another thing I wanted to mention is because this is something I'm always evaluating for, and it's kind of interesting. If you ever came in and saw me for, like, let's say you have dry eye, I always ask you to look down, and I lift up the upper eyelid. and I'm looking underneath the eyelid for possible redness that you see in this photo. And that's something called superior limbic keratoconjunctivitis. There is an association of thyroid eye disease and SLK, the superior limbic keratoconjunctivitis. They don't fully understand why. The theory is that perhaps as the eye bulges forward with thyroid disease, that the upper eyelid is rubbing more aggressively on the top part of the eye, causing irritation and this redness. But there is another autoimmune condition associated with SLK, and that's what's called Sjogren syndrome. And let me know again in the comments or in the live in the chat section here if you've ever heard of Sjogren syndrome. Sjogren syndrome is an autoimmune attack on your parotid glands here in front of your ear that create your saliva, as well as your lacrimal glands that produce your tears. So this is an autoimmune condition that results in very severe dry eyes, and because you're not making much saliva, also dry mouth. So when patients come in and they have severe dry eye symptoms, but they also maybe test really poorly in all of our dry eye tests, or they don't produce enough tears, I always am trying to ask, hey, do you have dry mouth too? Do you feel like you need to always drink water just to even swallow or have a meal? Or do you perhaps have a history of bad dental cavities? Sometimes dentists are the first ones to kind of identify this because someone's mouth is so dry, or they're having a lot of cavities, or their gums are not looking very well. So with Sjogren syndrome, it is something that we do have to order different tests for. And I do have another video I did a few years ago on Sjogren syndrome, and put a link in the video description as well as in the chat if it's something that you want to learn a little bit more about, because we'll talk in that video. We highlight the different blood tests that we do, as well as possible treatments that doctors can prescribe to help with this specific autoimmune condition that causes really severe dry eye. Now let's switch and talk about gut autoimmune conditions. Mainly the big ones are Crohn's and ulcerative colitis. These ones, I typically am always going to ask a patient who has something like uveitis or inflammation going on deep within the eye if they have a history of gut problems. And sometimes they're always like, why do you want to know if I have like chronic diarrhea? Why is an eye doctor asking me this? Well, it's because it's known that these conditions affect the eyes. And they not only cause uveitis, potentially dry eyes, but it also is linked to that episcleritis, the scleritis, and even at least a few cases of ocular neoplasia, which are irregular growths on the surface of the eye. And unfortunately, if they treat this, it often comes back. So the ocular neoplasia does. So it's something that Crohn's disease and ulcerative colitis is something that eye doctors are always kind of being aware of. And if you didn't know that they are connected to the eye, it's definitely something you want to tell your doctor that you have one of these diseases. This other one I want to mention is diabetes. Now, if you are somebody who pays attention, diabetes is a huge issue in global health, especially here in the United States, mainly type 2 diabetes, but type 1 diabetes is an autoimmune condition. This is where your immune cells end up attacking your pancreas and damage your beta cells, which produce your insulin. And so if you're not producing as much, or if you're not producing insulin at all, then you end up with really severe forms of diabetes throughout your whole life. Typically, type 1 diabetes happens more often in children or in your earlier life, but it still can occur later in life too, or your kind of middle-aged life. I even had a pathology or a physiology professor who developed this in his early 20s, and he believes it was because he was working with harsh chemicals, doing research for his PhD, and that maybe killed his pancreas. No way to know for sure, but it's a serious issue and affects the eyes. I'm not going to go too in depth about diabetes and how it affects the eye, but it can cause vision loss. It can cause bleeding within the back of the eye that causes swelling, and it causes damage to the blood vessels. You're at increased risk of a lot of other eye diseases like cataracts and glaucoma. And ultimately, if it doesn't get treated or monitored, the bleeding in the back of the eye can cause fibrous protein release that ends up contracting, and that can pull the retina off the back of the eye. And then that's very difficult to treat, and patients do get permanent vision loss from that. If you do want to learn more about diabetes, whether type 1 or type 2, This is a video I did even I think about a year ago on kind of breaking down more about how diabetes affects the eye. And so I do encourage you to watch that or share it with a family member who maybe hasn't seen an eye doctor for their diabetes, because if you are diabetic, you should be having a dilated eye exam at least once a year, if not more frequently, because your doctor recommends. In general, treatment for autoimmune disorders are very disease specific. Mostly it's revolving around anti-inflammatory because, again, you have this chronic inflammation. We need to keep that down. Strong corticosteroids, pain medication can help. Other immunosuppressants. Sometimes physical therapy can be used, especially for joint issues, and then possibly surgery. And then this lifestyle, I'm a big lifestyle person myself, and I need to work on all of these things listed. Eating well, sleep well, move more, reduce your stress, don't smoke and drink less alcohol. I'll admit my biggest weakness is probably sleeping and reducing stress. I need to do that more. But those are things that you can focus on, and definitely ask your doctor if there's anything else you can do. Maybe they've read more research, more publications on specific autoimmune conditions, especially if you're working with a rheumatologist. If they know if there's anything else in your diet or supplements, or if there's something that you can do to reduce your symptoms and other issues with autoimmune conditions. Now we're going to take a kind of a step back, and we're going to just do some live Q&A. I know we kind of went through some of these a little bit quicker than a lot of our other lectures, but this is a really complex topic, and I just know we don't want to spend 3 hours going deep into all the different possible autoimmune conditions. But if you have an autoimmune condition that we did not mention, drop it in the comments now, because here in the chat, we're going to be taking questions and going over them more in depth. Did want to give a shout out to all of our channel members. Thank you guys so much for supporting us. It really makes a difference. And thank you guys so much. And so I look forward to your questions. As always, before we start diving into the questions, and you can feel free to start putting in your questions right now, but I do want to just give kind of an advice disclaimer that I'm not going to be able to give you advice without giving a thorough eye examination. I think you deserve the best medical care possible. And to do that, you do need to see somebody local in your area. However, if you have a question, I'm happy to try and answer in the form of like education, so everybody can sort of learn from the different perspective of what could be going on, or if you have just a curiosity about the eyes or a vision thing that you've struggled with. With that being said, let's dive into some questions. I know I saw one question I wanted to start off with, because somebody was in the chat before the video even started. And so I just want to kind of give a shout out to that. And it was about Sylvia mentioning diagnosis of what is called CME. CME is cystoid macular edema. So it's a swelling that's occurring within the macula, the center bullseye of the retina on the back of the eye. And Sylvia wanted to know kind of what to expect, and you're afraid to lose your eye, of course. And I'm sorry that you're struggling with that, Sylvia. I'm really happy and thankful your doctor recognized it and is referring you to get that evaluated by a retina specialist. Cystoid macular edema can occur due to several conditions. Most frequently, it's due to after a surgery, such as cataract surgery. In fact, it's reported as high as up to like 50% of all cataract surgeries. There is some swelling of the retina, but it usually heals on its own before the final kind of follow-up, even within a month, 1 to 3 months. So a lot of times, cystoid macular edema from cataract surgery doesn't even need to be treated. But it does usually respond to just topical treatments, topical steroids, and topical eye drop, non-steroidal anti-inflammatory drops. Think of it like liquid ibuprofen. So people usually respond well to that. The other forms of macular edema can occur due to things like diabetes. It can occur due to uveitis, that's that chronic inflammation inside the eye, as well as even some other specific eye conditions. If somebody has like retinitis pigmentosa, for example, can develop CME. The good news is, again, your doctor caught it. They're going to refer you to a retina specialist, some of the best doctors in the world. They went to school for like 13 years just studying the retina and doing surgery on the retina. And hopefully you won't even need any sort of special treatments. They may just recommend either prescription eye drops, or they'll be able to at least give you some insight of what's going on, figuring out what the cause is, and if there's anything else that can treat it. Most cases of macular edema that I've managed improve, and patients are back to seeing where they were at originally. With all that being said, just be prepared when you see a retina doctor. You're going to be in a room with a lot of people, and we expect to be there for several hours, as there's unfortunately not a lot of retina specialists in the world because it takes a long time to go through that schooling and it's very intense. But they are some of the best doctors I've ever worked with and super knowledgeable. And so you're going to be in good hands. Okay. I want to go back and just see if there's a couple other questions. Let's see if there's anything specific. Um, well, I'm just going to give a shout out to Gail because Gail's awesome, and she's been a member here, and she's just kind of shouting out that she's had some esophageal difficulty. I'm sorry that you've been having some swallowing issues there, but I hope I'm glad that this week has been good. I do have a question here from Iman. Can you do a video on double vision and astigmatism and esotropia? I have done a video on double vision, at least talking about like top 5 causes of double vision. We have a video on astigmatism. We're even planning on doing another more in-depth one on astigmatism sometime this year, and then, or at least within the next 12 months. Esotropia, I have done a video on strabismus. If you type in strabismus, Dr. Eye Health, you may find a video on like lazy eye and eyes going crossed. And so hopefully those, it's just I don't think I've named it esotropia because most people don't know what an esotropia is. But an esotropia, just for those who are curious, is when your eye is turned inward toward like your nose. So if I kind of cross my eyes like this, that's kind of where your eye is turning inward toward your nose. That's eso. And if your eye is turning outward, that's called exo. Question about Hashimoto's and chronic recurrent uveitis. So Hashimoto's is, again, Hashimoto's thyroiditis, when you have a lower thyroid levels. I don't personally think I've ever seen a connection between Hashimoto's and chronic or recurrent uveitis. I wouldn't be surprised if there is some other connection between Hashimoto's and other autoimmune conditions may be going on, because recurrent and chronic uveitis is often associated with some other autoimmune condition. The downside is that sometimes uveitis just occurs and we call it idiopathic. We don't know why. It's basically, ideo is kind of thinking like we're an idiot. Like we just don't know why it's occurring. Yeah, I think there possibly could be a connection. Hopefully your doctor has done their due diligence. When you have a recurrent uveitis, they should be ordering blood work, or at least referring to a rheumatologist or another doctor who can order more. They can order more blood work to kind of figure out what could be connected to. Let's see. Oh, Barbara, thank you. Can stress cause arthritis and severe dry eye? So stress, anxiety, and depression strongly linked, both, and it's kind of has a duality of the sense that if you have a chronic disease like dry eye or arthritis, people are more likely to develop anxiety and depression for many reasons. It's tough to live with a chronic condition, especially if you're in pain and you feel you can develop helplessness because medications, you feel like you're relying on medications. You may be limited in doing things that you used to love doing. It can be really troubling. It's also been found that not only can chronic conditions cause anxiety and depression, but anxiety and depression can cause chronic diseases or make them worse. There's even some different feedback between cytokines and neurotransmitters that have been found to make these other systemic issues and amplify them. And that's a tough thing to kind of deal with, but it's part of, again, why lifestyle is so important, in that you need to try your best to get good sleep and eat well and get movement in if you can. I also am a strong advocate for mental health and just talking with a trained therapist or counselor, not just doctors and medical professionals, but speaking with a trained therapist and counselor, because I've had great success over my life and made great just headways in my own personal struggles. And I think it's something we should be talking about more. Life is tough and we all go through tough challenges. So definitely stress can affect arthritis and can affect dry eye. So I encourage you, if you don't already have a therapist or counselor, I think that's a great place to go. But also just mention to your doctors that you're maybe struggling, or if there's anything else that they can help you with. So thank you for asking that, Barbara. I don't know if I'm going to have an answer for this one, Gail, but thank you again for being a channel member and just being so present. I'm glad your eyes are doing good today. It's like, why during my heart pain issues on the weekend and last night, blurry vision? What's going on mostly at nighttime? It's tough to say that they're related. I think if you are having any chest pain or heart issues, definitely you want to see a medical professional in your area to make sure that you know why you're having those pains. There could be a lot of issues that could be going on if somebody's having heart and chest pain. Anything from your lungs in that area could be related to your lungs. It could be related to your heart, blood pressure, a lot of different things. So I think it's important to get that checked out always. Blurred vision can occur at nighttime because, one, it's night. We don't see as well at nighttime. Two, if there's something else inside the eye that's causing glare, like maybe a cataract forming, maybe the cornea has some swelling on it for some reason. If there's blurred vision because if there's dry eye because your eyes are dry, it's been a long day, could all be connected. And then your pupils dilate at night. If you're in dim light, your pupils get really big, and then more light comes in from stray angles, and so your vision can be degraded due to glare. Also, because your pupils are really large, your depth of focus gets thrown off. And so a lot of patients, I say patients, but a lot of people who come and see me, they're like, hey, I see fine during the day, but at nighttime, if I'm trying to drive, I can't really see the road signs. And part of that is because during the daytime, it's bright and their pupils are really tiny and they have really good depth of focus. But as soon as the nighttime, their pupils get really big and they lose that depth of focus. And so they just can't see the road signs as well. So I would say, as always, if you're having any issues with your body, especially around the heart, definitely see a medical professional in your area to get that checked out. And then for the eyes, of course, see a local eye care professional to see if they can maybe have a better explanation for that. Matt has great. Thank you for sharing, Matt, that you've Crohn's, you've battled that. I'm sorry that you've had that. Hopefully it's doing well for you. You've had a barrage of chalazions and dry eye, and you've never experienced them before. So something, if you've never heard of chalazions before, or some people pronounce them chalazions, these are a blockage of oil-producing glands in the eyelid. Some people get an infection of the oil glands, and those are called a hordeolum. But if it's not painful, it's just like a kind of a hard lump nodule on either the top eyelid, lower eyelid. Some people refer to both the infection and the chalazion, which is not, the chalazion is not an infection, but the hordeolum is. Some people refer to both of them as a sty. These chalazions, it's fascinating to read the research on them because it's believed to just occur largely due to inflammation, possibly from the oil glands. You're not maybe producing very good oils. Could be related to infection, either from a hordeolum or even Demodex mites, which are a dust mite that live on our skin naturally, but they can live on a lot of people's in the eyelash follicle. And that's been found to contribute to development of chalazions. So it's tough to say exactly why. It's hard to say Crohn's disease is directly affected to that. I personally have not seen research connecting the two, but chalazions and dry eye are definitely associated. The for children, this is just a side note about chalazions or chalazions. In young children, there's some research finding that children who are a little bit deficient in vitamin A, that they have a higher risk of chalazions. And so they can take supplements of vitamin A and then a lot of their chalazions decrease. But people over the age of 19 and older, it doesn't seem to have that same connection. So yeah, I don't know if there's quite a connection there, but talk to your doctor for sure. I have some videos on blepharitis and chalazions, and maybe having better eyelid hygiene may help decrease the amount of chalazions that you have. I know from a lot of patients that have recurrent chalazions that I see in the clinic, some of those patients are people who like work like as fry cooks, or they work in like a greasy kitchen, and because they're like over a hot stove all day, I believe the grease maybe affects the oil production on their skin, and then bacteria can get in and cause those issues. But that's very anecdotal. Just I wanted to kind of comment on lemur crazy because I'm seeing that. Yeah, Sjogren syndrome is really tough. And I'm sorry that your mother had that. The patients who have Sjogren syndrome do have pretty extreme dryness of the eye, and it's not just using lubricating drops on the eye. Usually medications have to be used to help, and even will prescribe oral secretagogues. I love that term, secretagogues, but they're basically medications that they take to help you produce more saliva, and a lot of times that ends up helping them secrete more from their lacrimal gland as well. It helps with a lot of their symptoms. But for anybody who maybe has Sjogren syndrome or is worried that maybe they do have something autoimmune related to Sjogren syndrome, definitely mention to your doctor again so we can get blood work test. Thank you, Kel, for asking. Do you need a referral from an optometrist to go see an ophthalmologist? No, you don't. But sometimes it depends, because if you do have an emergent issue, I'm going to refer you to the ophthalmologist, and then I can direct how soon you need to be seen based on the severity of the condition. So if you have something going on in the eye that I deem is an emergency, I can directly refer to them, and they're likely going to shuffle their schedule or put you in an emergency slot so they can see you within 2 days or 2 weeks, whatever it needs to be seen. Where otherwise, if you call up a busy office, an ophthalmologist may say, hey, we can't see you. We're fully booked for 3 months. So you can see where there might be most optometrists, at least in the United States, can handle most of the things and at least make a diagnosis. And if there's a necessary need to see an ophthalmologist, they can make that referral, and it's usually something that goes a lot smoother. So as far as I see a good question again from I want to say Kiara. Often when thyroid eye diseases are mentioned, they focus on Graves' disease. What are the actual risks of problems for patients with Hashimoto's? So Graves' disease is probably the most pronounced, and I think that's why people focus on it so much. Hashimoto's is, when it comes to ocular involvement, I believe is less than 5%. I could be wrong on that. I'm just calling from my memory. So it's not as frequent, but you basically get the same thing. In fact, the proptosis or exophthalmos, with the eyes bulging outward, can happen for people not only with Graves' disease, but Hashimoto's, even with euthyroid, where your thyroid levels are normal. It's kind of crazy. And so, but it basically all kind of presents the same way. So hopefully that answers kind of how it can present. We're getting a lot of good questions here, so I'm going to kind of try to catch back up. So hello, Vic. I see you from New Jersey. Let's see. Presumptions to get better. I'm going to call this one out for Emmy. Can you talk a bit about epimacular membrane? I think you mean epiretinal membrane, but or just some people call it a macular pucker. So I'm sorry that you had uveitis, but I'm happy that hopefully they got that treated and settled down. And an OCT, that's where we use an instrument in the clinic. It's kind of like getting an ultrasound of the eye, but it uses light. It uses infrared light and shows this extreme detail of the retina. We can see the individual layers. But the macula, or an epiretinal membrane, this is where the very superficial tissue of the retina, what happens is it starts to bunch up. It kind of is like a fibrous tissue that pulls forward and it pulls together, and it kind of bunches everything up. And I think of it because, like, usually in the clinic, I use like my pant leg to give a demonstration, but usually the retinal tissue is perfectly smooth. But for some reason, like from after uveitis or from new floaters developing, the gel inside the eye can change and pull on that retinal tissue just a little bit and create a wrinkle. And so an epiretinal membrane is a wrinkle that bunches up and changes the anatomy structure of the retina. A lot of times, an epiretinal membrane won't cause vision problems. But if it does, if it's significant vision problems that you are noticing a change, either that your vision's blurry or what we call metamorphopsia, which is my favorite term in all of eye care, it basically means that your vision is distorted. So you may see like a straight maybe like a light pole on the side of the road, but instead of going straight, the light pole kind of looks bent or jagged. And that could be a sign of something like an epiretinal membrane. So if you are going to see a specialist for an epiretinal membrane, for let's say your vision's really blurred and you need surgery, your surgeon can do an epiretinal membrane peel, where your retina specialist will go in and peel off that extremely thin layer of basically scar tissue, and they'll try to flatten out the retina to get it back into its regular shape. Some doctors I've met are extremely talented at this procedure, and they can get patients seeing better than 20/30, like 20/25. I've even had some patients come back with 20/20 vision. But a lot of surgeons I've worked with, they won't even do the procedure unless someone's vision is worse than like 20/30, 20/40. Because depending how severe the condition is, they may not get vision better than that to begin with. Either way, though, hopefully that gives you a little bit better perspective of what could be going on. But definitely follow up with your doctors. Ask them, how bad is it? Is it something that you need surgery for? Or if there's something else that they need to be concerned of or watching. So, this is an interesting question from James, just in general about medications in the healthcare world. Is there a reason to get the name brand medication over a generic version of the same medication, as generics are usually cheaper? So this is a good debate, and I think it depends on the medication. Usually, if you talk to like a chemist, I have a few friends who are pharmacists, who most medications that are generic, they have to follow the basic structure, patented kind of guidelines, but they may not mix the things the same way. So it's kind of like if you were going to buy a generic shampoo versus a brand name shampoo at the store. The generic, they have the same ingredients, but they may mix them at different times. They may mix them in slightly different kind of ratios, or they may use a different preservative, and they may only mix it as little as they need to, bottle it, and ship it out the door. There is a concept, a part of biochemistry called chirality, which has to do with how the structure of the chemical, of where your fingers are located. So like your left and right hand, they're like mirror images of each other, right? They both have 4 fingers and a thumb, but the placement of the thumb is on a different side than the other hand. So the chemical may look the exact same, but it's a mirror image of each other. In fact, there are medications where if they make the chiral version, the opposite version of that same structured chemical, one will treat you and help you get rid of pain. The other one can kill you. So it has to be very tailored, structured, made when it gets into the world of making medications. With the eye, there is some debate around some medications, brand names being more effective at treating things like uveitis, like patients respond better to topical steroids if they're a brand name versus a generic. Most of the time, I don't necessarily recommend brand name medications unless I really tell a patient, no, it's worthwhile for them to pay the extra. Like glaucoma medications, there are research studies showing that certain more expensive brand name glaucoma medications get a better efficacy, that they lower the pressure better and more reliable than maybe the generics do. So tough to answer that question. I think it very much depends, but talk to your doctor, especially if you're on a medication and if they think you absolutely need the brand name one or not, or consult even a pharmacist of what they think and what they know about that medication. And if if anybody's a pharmacist watching this and you think my answer is terrible, or if you think it's good, let me know your thoughts in the comments, because I would love to just learn more from your insights on it. But I'll talk with my other pharmacists friends and see what they think. I think this is a really good question. And probably this will be our last question for the evening, but thank you, Iman, again. I want to know, if I'm in college, how can I manage my double vision with large fonts? So double vision is rather challenging. Kind of the easiest answer that has been used for a long time are people who patch the eye. They'll patch the eye that's not as dominant. However, that may not be the end of best solution. I think talking, of course, to an eye care professional, if that's something that's going to be okay for you. A prism can be ground in, or even a press-on prism can be used for glasses to shift the image of the light of whatever's entering through your eye so that it helps better alignment, and it may correct for the doubleness. I think I just made up a word. I don't know if doubleness is a word, but that can be something that can be done. And as an adult, you can also try to locate and consult a strabismic surgeon, an adult surgeon who just works and specializes with adults with eye muscle issues. Usually, these surgeons also do they work a lot with pediatric patients, because a lot of kids are born with eye muscles that are turned inward or outward. But they also do adult surgeries too. So, but I would definitely see if you can talk with a local eye doctor, just to see if prisms, and make sure the diagnosis is solid and that there's not something else going on. Otherwise, if people are having sudden double vision, talk to a doctor. And if you can't drive or function, consider closing or patching that eye until you can see a doctor. So thank you guys so much for being on here, for watching the live, for having your questions. We will be presenting another live education next month. So for everybody who is a member, please watch for our member chats, as we'll kind of suggest a couple of different topics, as well as we're always open to your suggestions. And let me know any other kind of great topics you'd like to see for more dedicated videos, or even questions that I can answer quickly in YouTube Shorts. Thank you guys all for being here. Greatly appreciate you all, and hope you have just a fantastic evening. Thank you.